Muted.
Will be available on YouTube shortly. So people can share this with people who were unable to attend during the live broadcast, and they will be able to follow up later. So it has a little bit more life to it. Okay, I'm going to wait one more minute, and then we're going to get started. Should get a couple more to click in here. Questions. There is a chat feature at the bottom of your GoToWebinar screen. You will be able to populate your questions there, and we will be taking questions at the end of the webinar. We'll just wait one more minute and begin. Okay, well, I am going to leave that part. Okay, so welcome to the HCMA webinar series again. We are going to be discussing an NIH-approved research protocol today. However, we want to give you a little bit of a disclaimer here that the information contained in this program is for informational purpose only and should not be used to alter your personal treatment of hypertrophic cardiomyopathy. The HCMA does not endorse any product, and this webinar should not be interpreted as such, although there is no product being discussed today. During the question and answer period, you may address general questions about the protocol and how it impacts your HCM, but we should not be getting into individual treatment questions. If you do have any additional questions that aren't answered during the webinar, by all means, please contact the HCMA and we'll be able to assist you with your questions after the webinar. Now we're going to start with Dr. Rachel Lampert, and I'm going to give the controls to Dr. Lampert. And
Charlene's going to start. Charlene's starting.
Uh-oh.
Dr. Day.
Oh, sorry. Did that the wrong way. Sure. Okay. Sorry. Dr. Day is starting. I had that backwards in my head. Charlene, you should have the controls. Oh, it's not working the right way. It's
Just went off.
I'm going to take it back, Charlene. My apologies.
Okay.
Hold on one second. Are you back to the?
I'm back now. I can see the. Yep, I can see the screen.
Okay. So we're going to do advanced slide because I should have given you back this webinar or this PowerPoint to function. Sorry, technical difficulty.
That's okay.
Just say advance and I'll advance. Go ahead.
Okay. So I wanted to provide an introduction about exercise in hypertrophic cardiomyopathy. There are obviously a lot of questions that we hope to answer, and some of them we have answers to, and others we don't. And that's the purpose of the LIVE registry. So we want to know how much exercise is safe and how much exercise should patients with HCM be doing. What type of exercises are safe and what type would be advised, and how hard should patients with HCM be exercising. So for the purpose of this discussion, I'm going to break exercise into either competitive exercise or recreational exercise. Okay, advanced slide. So the questions regarding exercise in HCM have largely focused on potential risk associated with sports participation. And the primary concern is the possibility of invoking a dangerous arrhythmia that could cause a cardiac arrest or a sudden death. Now, sudden death during sports is an incredibly rare event, but obviously these are very tragic. Some of these deaths are due to HCM, but there are also many other causes. And currently, it's not known for a given individual whether playing sports or participating in vigorous exercise increases their risk of a sudden cardiac death in that particular individual. You can advance. So there are published guidelines. The first guidelines were published 10 years ago, and there's been a recent update to the guidelines that address participation in competitive sports for individuals with HCM. The guidelines uniformly recommend against universal exclusion from almost all sports for individuals with HCM, with no major change over the past 10 years. The updated guidelines also advise against prescribing medication or placing a defibrillator for the sole purpose of permitting participation in sports. And the recent updates also allow for some individual decision-making by the following statement. These recommendations do not strictly exclude in absolute terms fully informed athletes from participating in competitive athletic programs as long as such decision is ultimately made in concert with their physician and third-party interests. Next slide. So why have the guidelines for sports participation HCM not changed in 10 years? Well, largely because we don't have much new information. The guidelines are largely based on expert opinion. There is one exception to that, which is the Sports ICD Registry, which was led by Rachel Lampert. And Rachel and her colleagues had a number of individuals participating in a registry who were also doing vigorous exercise or competitive sports. There were many different diagnoses in the registry. 65 of the athletes had hypertrophic cardiomyopathy, and 13 of those were participating in competitive sports. There were no deaths, resuscitated cardiac arrests, or injury or damage to the device as a result of participating in sports. And there were 2 appropriate shocks, and the defibrillator worked as it was supposed to. So there are new data in a different genetic heart condition that shows that the risk of a cardiac arrest during competitive sports with that particular condition is extremely low. And the updated guidelines for that condition now suggest that participation in competitive athletics can be considered after a comprehensive evaluation and with appropriate preparation for an emergency. So what we hope to do is gather the same type of information for individuals with HCM. Now, by considering making recommendations for individuals with HCM, and particularly restricting their athletic participation, we can't forget about the benefit side of the equation for individuals participating in organized sports. So children who are physically active are less likely to be obese. They're more likely to have higher test scores and perform better in school. They're less likely to have risky behavior. They're more likely to go to college. They have lower health costs and ultimately a reduced risk of heart disease, stroke, and cancer. Can you advance? Organized sports also foster leadership skills, teamwork, coping, goal setting, focus, cooperation, and social skills. Go ahead. So now I'm going to turn to recreational guidelines. Guidelines for recreational exercise for patients with HCM. And these guidelines are essentially based on very few data and are largely expert opinion. Go ahead and advance. These guidelines stratify different sports according to the perceived level of intensity. So those sports that are advised against include those that have an anaerobic or burst component, or isometric exercise such as heavy weightlifting, or sports for which there's a risk for trauma related to impaired consciousness, such as rock climbing or scuba diving. Sports that fall into the intermediate risk category are those that could be assessed on an individual basis and are generally those that would have a more moderate intensity aerobic component. And those that would be considered probably permitted are those that could be done at a low to moderate intensity. But keep in mind that many of these sports can cross over these different categories. So for example, swimming can be done at a very low intensity, but can also be done at a highly competitive level in an anaerobic way. So I think these categories are useful, but we have to keep the individual in mind when we're making recommendations for recreational exercise. Go ahead, Lisa. So a few years ago, we surveyed the HCMA population and compared their responses to a national population called the NHANES. This is a publicly available database. The survey contained questions about lifestyle, including their exercise and diet. And what we found is that HCM patients were overall less active both at work and with recreation, although many HCM patients were also quite active recreationally, and some were doing even vigorous or competitive sports. But overall, when we looked at the average HCM patient compared to the average patient in the general population, the HCM patients were less active. We also asked the question of whether HCM patients had purposely reduced their exercise, and many of them said that they had, and 64% of them said that purposeful reduction in exercise had a negative emotional impact on them. We also noted that the average body mass index for our HCM patients was over 30, and that is considered, that's the threshold for obesity, compared to about 27 for the national population. So what we inferred from that is that it's possible that that obesity is caused by a more sedentary lifestyle. Go ahead and advance to the next slide. So ultimately, we need more information. Existing guidelines are based on little more than anecdotal evidence. We don't know if the risks are truly higher for someone with HCM for them to participate in competitive sports or to exercise vigorously than if they were less active or sedentary. In other words, we know what makes the headlines, but we don't know what doesn't. There are many people with HCM who are probably able to participate in more vigorous exercise or even competitive sports safely, but we don't yet know the answer to that question. Exercise restrictions can have a negative impact on the quality of life and also on general health by causing obesity, sedentary lifestyle. Thank you.
And now we're going to hear from Dr. Lampert, who's going to talk to us a bit more specifically about the LIVE-HCM study and what exactly it is that we're looking for. Rachel?
So we've just heard from Dr. Day about all of the places where we really need to get some more data, get some more information to help us guide people who have HCM in making decisions about what kinds of exercise are safe and what is good to do. And so in order to try to get some of that information, get those answers, we initiated a study called the Exercise and Genetic Cardiovascular Disease Study that is shortened, we say LIVE-HCM. Next slide. So the purpose of LIVE-HCM is to determine how lifestyle and exercise impact the well-being, both the physical well-being and emotional well-being of people who have hypertrophic cardiomyopathy. Next slide. So who can enroll in LIVE-HCM? Basically, almost everyone who has HCM or who has a gene for HCM or HOCM and has a family member who has the full disease can enroll. We're looking for people who are age 8 to 50 years old. Whether you do or don't have an ICD, you can participate in the study. Some people are just enrolling as individuals, of course, and we also have a lot of families enrolling together. These families don't actually have HCM, they're just from the web. But a lot of children are enrolling with the parent that also has HCM, and families are participating together. Next slide. People can enroll who are doing exercise at any level or no exercise at all. So it's really a registry where we're looking at lifestyle choices and exercise in everyone who has HCM. So whether you like to run or walk, or you like to sit and read a book, work on a computer, really whatever types of things you're doing, we'd love to have you in the registry. Next slide. So as Dr. Day pointed out, the safety of vigorous exercise for those with hypertrophic cardiomyopathy isn't known, and current guidelines do recommend that HCM patients refrain from participation in competitive sports that are more vigorous than golf or bowling. But as Dr. Day described, a recent survey which she has done has suggested that despite the guidelines, some patients with HCM are participating in more vigorous sports. The study doesn't endorse competitive sports for HCM, but what we want to do is obtain information on the risks and benefits of exercise at all levels, again, from walking to running to reading to everything, by following individuals over time at whatever level of exercise they're currently engaged in. Next slide. People can enroll in this study directly through the coordinating center. The questionnaires and interviews are all done over the phone and over the internet. So there's no geographic constraints to participation. Anyone in the US, Canada, England, or Australia can participate in the registry. Next slide. It's also okay to participate in other studies at the same time. As everybody probably knows, there's a lot of exciting studies going on now in HCM. Because LiveHCM is just a registry, there's no interventions, there's no nothing will change in your life. You can be in any of these other registries or even the randomized studies and also be in LiveHCM. Next slide. So what does participation involve? It's really not a lot of time commitment. There's no new testing, there's no new blood work, there's no interventions. What we do is once you call us at the coordinating center, and we ask you to sign the usual paperwork over the phone and by fax, we'll then obtain your medical records from your own doctors. We will get a copy of your echo, which is read by a core lab at the Mayo Clinic, and then once they've looked at the echo, we have all your records. We then ask you to do some questionnaires, either over the internet for adults or by phone for children under 18. The questionnaires have two main focuses. One is on activities. There's a detailed questionnaire. What are you doing now? What did you do earlier in your life? Ranging from all activities, from exercise to meditation to whatever other, going to church, to all different types of activities. And then there's another set of questionnaires that ask questions related to quality of life. Overall, the questionnaires take somewhere between 20 and 40 minutes, and it's fine to save and come back, and so you don't have to do it all at once. Next slide. We also ask participants to wear a Fitbit Zip, which is a pedometer that you can either, it has like a little clip in the back that you can clip onto your waist, your pants, or we have a wristband so you can wear it like a watch on your arm. It's just a basic pedometer. We ask you to wear it at minimum for 2 weeks at the time of enrollment and 1 week every 3 months. But you can wear it as much as you like. You can access your data on the website, and it's just, you just get the free Fitbit and can use it however you like. If you already have a Fitbit, we can just hook in with the data that you already are generating on the website. Next slide. Overall, participation is 3 years. Most of it really is going on at the beginning. And then every 6 months, we send you a link to a very brief internet questionnaire. There's just a handful of questions. We send a reminder and a link. And then at the very end, we again ask some other questions at the end of the 3 years. Next slide. So far, we have over 300 HCM patients enrolled. Our goal is a little over 2,000. So we're getting there. We do have a ways to go. The people who are enrolled so far, I think, are really enjoying it. We've had people say all kinds of nice things about the study. A 32-year-old, the study captures the biggest question in my life right now because she wasn't sure how much exercise she should be doing. A mother of 2 adolescents, this study is helping empower my kids take control of their diagnosis. So I think that people are really enjoying this study. And here's an 8-year-old said he's having fun with the questions, but he's really just doing it to get the Fitbit, and that's fine too. You know, I think people really are enjoying the study that are participating. Next slide. So if you're interested in enrolling, you can contact us through a couple of different ways. If you want to just reach us directly, there's our phone number. We have an email address, and we have 3 study coordinators, Teresa, Cheryl, and Sherry, who can talk to you more about the details, get things started. I know Lisa has also put on a link where you can access the brochure for the study that also has these has the email and the phone number and the contact information. And so I'll leave it here, and I think we have some time for some questions.
Okay, well, anybody who has a question, they can write in their question now. If you click on the handout tab on your webinar screen, you will see 2 different PDFs. One's actually the front, one's the back of the brochure. So you can have that information right now, and you can take that and hand it out to anybody else in your family who's HCM positive, either genetically or clinically. I did have a couple of questions for our presenters today. We've talked a lot about what the risks of sudden cardiac arrest are, and that is the primary focus of this particular trial, and we're looking to see if it increases sudden death, if people are active in sports, as well as just overall activity level so we can get an idea of what people are doing. But are we going to be able to assess what might happen in terms of heart failure with this patient population? Can one of you or both of you address what we might be able to learn there?
I'll go ahead, Lisa. So the primary goals of the study are really to look at things like passing out ICD shocks and then all of the quality of life types of questions. Whether heart failure gets better or worse with exercise, we really don't know. I think there's some data on either side as far as the overall progression of the disease with vigorous exercise. This study, we are not getting echoes as part of the study, but we will be trying to obtain echoes that people have had for clinical, just for clinical purposes over time. And so this study may help us start to answer the question, although I don't think it will give us the final answer. It will probably give us preliminary data that may enable us to move forward with other studies to answer that question.
Thank you. The questions are a little slow today, so we're not getting bombarded with the normal amount of questions that we normally get on these.
If I can add to that, I think
sure.
you know, we will be able to stratify people according to how much they're exercising, and we'll have a lot of information from their physician in the program where they're followed. So it won't be a cause and effect type of relationship that we could establish, but we will be able to see whether there are more patients with heart failure who are less active, that sort of thing. So, I think just given the duration of the study of 3 years, I think it's unlikely that we'd be able to answer that question prospectively, meaning that somebody that's exercising more develop heart failure over the course of the study. But we will be able to stratify people according to their level intensity of exercise and those types of symptoms and clinical outcomes.
Any other final thoughts that either one of our presenters has today? I think you've done a good job at explaining this because we don't have a ton of questions.
Okay, well,
so we're trying to get another 2,000 participants, or nearly 2,000 participants more.
Yeah. So we are enrolling through individual sites as well as through the directly through the Central Coordinating Center. So you know, Dr. Lampert, is there anywhere where they can access the sites that are included in the study?
You know, I'm realizing we don't have that now. That's something we may be able to put on the website in the future. But right now, I think you could either ask your doctor if their center is participating, and if so, you can participate directly through your HCM physicians. But if your own doctor is not a specific site for the study, then people can enroll through the Central Coordinating Center.
So just to review, for purposes of having all of the data when this gets uploaded to YouTube later today, I hope, if you're not being evaluated or seen at an HCM Center of Excellence, you can still participate in this particular trial by contacting Dr. Lampert's office directly at Yale, and they will do all of the backup work to get all of your health records for evaluation. And out of an abundance of caution, I think it's important that participants know the reason that there's a core lab evaluating all the echoes is to make sure that we really have HCM patients in the trial and that the experts have had an opportunity to review the care model to make sure that the patients are being evaluated and that their treatment is consistent with the data provided for HCM. Is that correct?
Yeah.
Yes.
Okay. So we're being really careful here because we don't want to have anybody get hurt or anybody participate in a trial that really doesn't belong in the particular trial. But I have been very happy with the study design, and the HCMA has worked with all of the investigators on this trial to ensure that this is as robust of a study as it can be. And now we need to get to work to get all of the patients populated so that we can follow them up for the ample amount of time so we can get some data out of this. Any parting thoughts before we stop the recording?
Lisa, we really appreciate all your support.
Happy to give it to you. So anybody who has any questions, please contact Dr. Lampert directly or your HCM center. I know the University of Michigan is doing their enrollment on site there, so if you happen to be a patient of Dr. Day's, you can just talk to her or her staff about it, or contact, again, Yale, and Dr. Lampert's team will assist you. We hope you consider participating, and we thank you for your participation. Have a great day.